All right. Well, hello everyone. It is Monday, July 20th, and I am glad to be with you today. You might notice that I'm not Jen. Uh, I am going to give you a couple of updates, however, like Jen does. And then in turn, we also have a guest speaker today to talk about some mental health and other types of topics. First off, I am going to start out with the weekend numbers. As you know, we don't currently report out over the weekend, and so we give you those updates today. We had 22 new cases overall over the weekend. 14 of those were on Saturday, and 8 of those were on Sunday. They were from a range of demographics, and those can be seen on our Facebook page. Next, I will go over our local and state numbers for today. Our current local numbers, we had 8 new positive cases, and for a total now of one more than 665 total lab confirmed cases. We've had 6 people hospitalized, and ever hospitalized, we have had 29. We have had recovered 518. So right now we have 148 active cases, and we have had 1 death. Our state numbers, they currently are at 43,018 cases, with an increase of 703 cases from yesterday to today. And then their negative numbers, they had 737,191 total negative tests for an increase of 6,289. They have currently 22 people hospitalized, with an ever hospitalized of 4,129. They've had 33,130 recovered, and they have 2 new deaths to report for a total of 846 deaths. Now I would like to introduce Sarah Johnson from the YMCA, their mental health expert. Thank you for joining us today, Sarah.
Thank you for having me. Hey, everybody. As Carol mentioned, I'm the mental health director for the La Crosse Area Family YMCA, and my role is really to help bring my years of skills, experience, and training as both someone in the prevention world, trying to help reduce the risk that people will become ill in many different ways, as well as my experience, skills, and training as a therapist, so a counselor. So I'm here to help kind of sprinkle my skills, experience, and knowledge in the brains of everybody around me, so that we all can be healthier and hopefully reduce the risk that we experience difficulties in our life that can be prevented. So I want to start today by first expressing my condolences to the family who have lost somebody as a result of COVID infection. I'm thinking a lot about you, and know that grief is a really difficult thing. And so as I was reflecting on your loss, I was thinking about kind of the collective grief that many of us are experiencing across the globe right now. And so I wanted to talk a little bit with everybody today about what that might look like, how that might show up for folks. Knowing that there's no one way to grieve. My cat Snazzy Pants has decided to join us here. There's no one right way to grieve. We all experience grief in different ways. And grief can show up as exhaustion, just feeling really run down, being really tired. It can show up as disbelief. It can show up as sadness. It can show up as anger, agitation. So it can show up in a lot of different ways. And sometimes it shows up as all of those things at the same time. Sometimes people talk about grief as somewhat of a roller coaster, or somewhat of a spiral staircase where you may be taking steps forward, but rounding the corner, you experience some familiar difficulties. There's no wrong way to grieve, and grief, thinking about it, is really an honoring of what's important to us. So we don't grieve things that were not valuable or didn't have a meaning to us. We don't grieve people we didn't care about. We don't grieve experiences that we didn't care about. So as I think about, for many of us in our communities right now, we may be experiencing grief in a number of different ways. So you may be experiencing a sense of grief around normalcy, predictability, around routines or traditions that have been disrupted. So I'm thinking about, families thinking about, usually we think about what fall is going to look like and kids going back to school and teachers and all of the school staff have this predictability, and that's called into question right now as we're trying to figure out what's going to be the safest way to attend to both the social and emotional needs of our young people, as well as keeping everybody safe and physically healthy. Many of us may be experiencing a loss of finances or some job insecurity, income insecurity, loss of income, and then that may have some accompanying grief along with it in terms of housing insecurity or food insecurity. That may bring to mind the sense of grief around self-sufficiency and independence, right? If I've never had to ask for help before, but suddenly I'm facing financial insecurity, there can be a whole other grief there of feeling like I don't know how to, or if I can, or if it's okay to allow myself to lean into some help and structures. I may not know how to do that. I may not be comfortable doing that, even though that's a really healthy thing to do, is to lean into support. Some of us are experiencing grief around the centuries of systemic oppression that has caused just absolutely disproportionate health disparities in our Black and Brown neighbors across our communities. Some of us are also grieving a recent loss over the weekend. We lost two really important civil rights leaders in our country, in Representative John Lewis and Reverend C.T. Vivian. So there's loss around and grief around losing individuals and people that maybe we've never met, but who are important to our history and to our culture. Finally, we may also be losing this sense of narrative, some of us in our communities, around what we thought was true, what we thought was history, and what was a normal experience, as we begin learning that actually there's a lot of experiences beyond our own, and there's a lot of friends and neighbors who maybe have been unintentionally hurt, or sometimes intentionally hurt by our actions. So there can be grief around that loss of identity and sense of, am I looking at a different history than I was taught? Finally, I really think an important piece here is thinking about grief around the sense of what should be, what we thought our future would be. And some of that might be a loss of control and a sense of, I thought I was in charge of XYZ in my life, and the many, many different disruptions that we're experiencing right now are really revealing that I have less control than I thought I did. And that can be a very dysregulating and really, really challenging, stressful thing to experience. And so when I think about, that's a long list of things that maybe friends and neighbors in our community, including ourselves, may be experiencing. And that's not even all inclusive. And that's not including any of losses or grief or stressors that people were experiencing before our global health crisis. It's not including extra things that just happen on a day-to-day basis that add stress. So knowing that there may be those of us in our community who are experiencing just layers and layers and layers of grief and perhaps trauma. And so when I think about that, and I think about this moment in time, I think it's so important for us to remember that we grieve together, and that none of us are going to get through life without hardship or without grief at some point. Maybe right now you're doing fine, and I'm thankful for that. I'm hopeful that there are many in our community who are doing well in this moment and experiencing resilience. And we know that there are many in our community right now who are struggling. And that struggle may show up as grief that looks like exhaustion, overwhelm, disbelief, sadness, anger, and a reach for trying to control things that maybe isn't the most effective, or maybe isn't even possible right now. So when I think about the fact that I can't just look at somebody and know what their grief is, I can't just look at someone and know what their trauma is. I don't know what somebody's experience is just by looking at them. The same is true for every single one of us. You can't just look at me, Sarah Johnson, and know all of the experiences I've had, the trauma I've had, the grief I've had, unless I tell you. And right now, we are in a time where we know that even if we weren't in this crisis, many across our community have experienced trauma, have experienced losses. And so to show up in a way where we can have compassion and show up in a way where we can offer grace and self-compassion, grace to others as well as ourselves, that's going to be so important as we continue to move through this uncertain time. You know, people are tired of the word uncertain, and I'm tired of it too, because we're all tired of this uncertain time. We're tired of this. And in order to get through this, the best version of ourselves, the most cohesive community that we can, the most resilient community that we can, we need to care for ourselves just as well as we care for others. And we need to care for each other. It's so important that we do that right now so that we can show up with calm as well, right? So if I'm working to calm myself, I can show up a better version of myself for you. And we can nurture calm in one another. That's how humans actually regulate. Your system helps me regulate, and my system helps you regulate. We've talked about, oh, I've got my brain dress on today, so you can know that, you know, I was thinking about brain science today as I was thinking about talking with all of you. So our systems, our nervous systems, help regulate each other. And so if I can cultivate calm, I can bring that to our relationship, which is going to help you cultivate calm. That's going to help us to have a greater willingness and ability to learn, right? If I have got a sense of calm, I've got full access to all of my brain, meaning this front part of my brain that helps me make decisions and helps me be open to understanding and learning about other people's experiences and letting go of my own sense of what must be true, my way or the highway, right? I need to be able to be calm and open to understanding your experience, my friend and neighbor, may be radically different from mine. And the things you may be grieving in this moment may be really different from me. And so I'm not in a position to judge your pain or your grief. I need to be in a place where I can really truly listen to understand your experience and understand what's important to you so that I can help you help yourself and help you get connected to support and help you take care of our community in all the ways that we can. So I want to give us permission to change our minds. So if in this moment you are reflecting, and I'll tell you, I also have mirror earrings on today because I'm being reflective. I'm being self-reflective and thinking about my own experience, my own behavior, my own biases, the ways I show up, my own blind spots. I really want to be able to show up the best version of myself and to be able to truly care for my community. In order to do that, I need to reflect on my own prejudices, my own ways of seeing things, my own getting in the way of things, so that I can truly listen and show up and truly honor what's real in whomever I'm interacting with. And so I want to think about the fact that previously the way I thought about things and the way I communicated and the way I showed up, decisions I might have made, were based on the information I had and the circumstances and experiences I was having at that time. And as a result of a lot of different things, these disruptions I'm talking about, these disruptions, some of them have been truly phenomenally beautiful and incredible in allowing for greater learning and more voices to step up to conversations that we desperately need to have across our globe. Which means that I might have to change my mind on things. I may have previously thought that this thing was true. And now in a new context with new information, new science, new relationships, reading, more exposure to different things, exposing myself to different ways of thinking, I may think about things differently today, which means I'm a human and we're allowed to change our minds. And so if you've had arguments with people online, if you've had arguments in your neighborhood, if you've had arguments with family members, it's okay. Allow it to be. Everybody's human. We're all doing the best we can. We all have our different things that we're grieving or that we're experiencing. We all have our own past experiences that really lend themselves to that experience. And so kindness, compassion, forgiveness, flexibility, these are the things that are going to be important. And an ability to step away from holding on to what's true. My way or the highway is the only way. So I want to just take a moment to give you an opportunity to think about a couple of reflective practices that, off of this call, if you choose to do, may be helpful in this moment. And then I'll invite Carol back on because I know we'll want to be able to answer some questions for the media as well. So if you have a moment to reflect in the next day or week or coming weeks, I would ask you to ask yourself, either just to think about it, maybe to write about it, maybe to talk with others about it. What would it be like to show up in this moment with calm, compassion, kindness, flexibility, a sense of forgiveness for others, and a willingness to learn and hear from others' experiences? What would that be like to show up that way each moment? And what would that be like if every friend and neighbor in our community showed up in that way? What would this community be like? I invite you to take a moment to reflect as well on how can you let go of something that has been something you've been holding tight to, a certainty or your way or your expectation of how things should be. Are you able to allow that to just simply be for a moment and not hold on to it so tightly? Can you just loosen that grip just a little bit and experience, what does that feel like? Can you take a moment sometime in the next day or next week to simply look up into the sky, find a patch of open sky, and in that moment, surrender your worries, surrender your sense of what needs to be to whatever makes sense to you. That could be God, that could be nature, that could be the sense of divine, that could be a sense of mystery, it could be to just the great void. Can you allow yourself to surrender a little bit of that and let a little bit of that go out into the sky? And I know this is the part where I'm sounding like a hippie. This is welcome to me, hippie scientist, wears a brain dress. But finally, in this next day or week, can you then, after letting some of that go, can you allow yourself to feel your feet on the ground below you, and simply be thankful for this moment that you have, just this one precious moment that you're sitting in, right here, right now, knowing that you're sitting in this moment with others across our community who are also growing and learning and in pain, some of them very deep pain. And we can be here for each other in this moment. And what an important moment to be here for each other. May we all show up for ourselves and each other with steady heads and open hearts. May you be safe, may you be well. If you have questions about getting support, or if you need some additional support, if any of this is ringing true to you and you're finding it difficult to manage how you're feeling in this moment, I really encourage you to reach out to your support people. So who are the family members or chosen family members, or neighbors, who are the folks who can be supports to you, who I am sure would be so happy to help you in this moment. And know that there are some really excellent community resources. So calling the phone number 211, you can get a trained professional who's there, who wants to help you 24 hours a day, 7 days a week. You can also, if you prefer texting, text TALK, the word TALK, to 741-741. Again, so thankful to be able to be here with you in this moment, and it's really reflective about our brain science of compassion, kindness, forgiveness, flexibility. So thank you, Carol, for having me here.
Sarah, thank you so much for your insights and your thoughtfulness. We really appreciate that in this time with everything going on and so many uncertainties. So thank you. Sarah is going to stay on for Q&A with us, and I am going to give you a couple of updates now. So from last week, I know that there was a question about our max number of tests that were available for our National Guard testing site. And previously, that number was 400, which was what we had requested for that site. It now is 450 is the max number of tests that are available for our National Guard testing sites. So this week, we have a testing event on Friday, July 24th, which we have requested that 450 testing kits for. And the event is from 10 to 4, and so it's a shorter length of time. So we have added an additional lane so that as people come, that should help us be able to accommodate everyone that would show up for that event. And then also the other update Jen had for me to share with you guys is the request to address the total hospitalized versus ever hospitalized. As you can see in the data I reported out today, I did have that information for you, so it will become part of our weekly updates at our media briefings, and at some point in time our team will look to add that to the information that we update on our Compass website. And those are it for my updates. So I now open it up for questions.
Hi, Carol. This is Warren Sears from WXW. Can you hear me okay?
I can.
All right, thanks. So we've been seeing people getting tested with symptoms, or maybe people that have been in contact with somebody who tested positive. With the increase in testing, do you think that just anybody will be able to get tested soon?
We do not foresee there being a time in the near future that anyone who wants a test can get one. Right now, the best way we can use the limited testing amount and capacity that we have in our area is by testing all that have symptoms and then testing those that are in close contact with them of a positive case. Other populations we also have to prioritize include our long-term care and assisted living staff and residents, our homeless population, and eventually we'll have university students that are back in the area. These are part of our longer-term testing strategy that we have, and it is important that we just remember that a test only tells you if you've had enough virus present in that particular body location to turn the test positive, and that is just one moment in time. So it's always just only a snapshot. So you may test today and it might turn negative because you haven't been in contact with a close contact, or you may not have enough virus buildup yet. So we do not foresee any time in the near future of that happening. Thank you for that question.
Yeah, hi. Vernon County announced a National Guard testing site in their little info. They said people asymptomatic are going to be able to get tested, which essentially means anyone can get tested. Will that be the case in La Crosse?
Currently, for our National Guard testing sites, we still are focusing on the symptomatic people, and we have seen an increase in the number of people that we have been coming out that are symptomatic. I do know that they typically haven't turned anyone away because they were asymptomatic, but the focus really is on those symptomatic people.
Hi, Carol. Do we happen to know the results from the most recent National Guard testing site as far as how many people were positive?
Yeah, that is a really good question. I do know we did report some numbers out last week about what the positive numbers were. We had that a couple of days. We do not have the final official report, and our staff is working on that. And hopefully we'll have an update for you on Wednesday with that information.
Do we have any other media questions for Sarah or Carol today? Looks like we do.
Yeah, Warren Sears, WXOW again. Hey, what are your thoughts on certain companies, especially some of these bigger companies, implementing mask mandates? And also, what is your message to those that are seeing or that are strongly kind of pushing back on that, or maybe upset about having to wear one now at a lot of the big name stores?
Yeah, so, we see that as a step in the positive direction. These larger companies that are asking people as they come into their store to wear masks and making that part of their mandate for coming in there. We know this is one of the tools that we have for helping to protect others in our community as far and for those we have limited tools, so it's one of the tools, but you also can stay home when you're having symptoms, wash hands routinely, and maintain physical distancing when around people outside. And as for those that are pushing back, sometimes it's just a lack of the unknown. We understand and appreciate how disruptive changing your routine can be. So we're not used to wearing a mask. We haven't been wearing masks our whole lives, or, if we've had certain conditions. So this is one of those, something new, and change, or experiencing these new items and what that must feel like. And so we just need to remember that it is a way that we can help protect others in our community, and we think that that's an important piece. And although some people may fare well when they contract COVID-19, so if you're part of that, well, I may or may not get it, we know that it affects everybody differently, and you don't know how it's going to affect you or the person that you're next to, so that is what we would say on that. Thank you for that question.
Do we have any other media questions today?
Just thought of this, that with hospitalizations, you guys are announcing that now. I know the state, and I know Jen, maybe you can answer this, maybe you can't. I know Jen said last Wednesday, there were people in the hospital, but nobody was in the ICU per se. And then obviously 2 days later, we had a death. I don't know if you could explain this, but can we talk about how the virus kind of just takes over and we go from just being hospitalized, not having to be in the ICU, to all of a sudden, like we that person in the hospital is now dead? Does that make sense? Like it's rapid.
Yeah, I think you just hit the nail on the head. It is rapidly progressing in some people, that in some people it just takes over their whole body system, so they may not have had a need to be in the ICU. We're able to do some of that some of their procedures just in the regular hospital room, so they're not needing to be in ICU, and then they can just be overtaken by it. And the other thing I want to say is, it's just a really sad time right now that we lost one of our own. Any resident death in our county is one too many. So, our hearts and thoughts just go out to that family right now. And we just want to encourage everyone to do what they can in the community, to keep others safe. There are things you can do. You can wear that cloth mask outside of the home and wash your hands frequently, using soap and water, practicing that physical distancing, utilizing the grid that we've put together in the compass for really guiding your daily activities. It's all those things that we can do are really important. So yeah, even though we, aren't reporting out, that anyone was in ICU and that moves so quickly, that's one of the reasons.
Hey, Carol, we do have a question from Mal Meyer at WKBT. He asks, why was Aquapalooza forced to cancel while the bass tournament and other events were allowed to go on as planned?
Yeah, so that is a really good question, Mal, and, something that we've been thinking about. So we learned about the Aquapalooza on Friday, and so our health officer has the ability, or her designee, which would be me this week, as our health officer is taking some much needed time off, but has that opportunity to write orders anytime we feel that there is an increased risk for communicable disease spread. And so we had not received any plans from Aquapalooza, and in doing our research on, how many people could potentially be there and just the different situation, we did issue an order for that not to take place. And then as far as the bass tournament not having any orders written for it, part of that process was they had been working with both the city and the county for quite some time now, submitting plans to us, and they actually had some mitigation strategies in place. So they had staggered start times for the boats to leave, so they weren't all congregating there at one time. And then their weigh-ins, which are usually have a big public turnout for everybody seeing the fishermen weigh their fish, they did a live stream version. So the fishermen and the boater, they could be there weighing their fish, but to see it yourself as a bystander, you would have to watch the live stream.
Any other questions today from our media? I am not seeing any, Carol.
Okay, then I will wrap us up by saying I would just like to thank our guest, Sarah Johnson, for joining us. I appreciate that so much, and giving us some guidance for taking care of ourselves and just being more mindful and kind. And I really like that letting go idea. Something I'm going to try and practice a little bit more myself this week. Also, I would like to thank all of you for your efforts on reporting on what we are doing and keeping up to date on the information and data that we share. As a reminder, you get me again on Wednesday with updates, along with we are going to have a guest speaker, Jackie Cutts, our nursing manager and our operations section chief, and she will be on to share our current data and metrics on Wednesday. Thank you all.